I think one of the things that we want to make sure you come out of today is with new partnerships, new relationships, new ideas on how we can be more intentional about working together across sectors, in particular the community economic development sector and healthcare, to improve the health and well-being of our South Florida community.
For those earning between 0 to 50% of the area median income, call it about $45,000 a year per household, we have a shortage of over 135,000 rental units just in Miami-Dade. Of the 37 or so thousand jobs that are going to get created in the next decade, 70% of them are going to pay less than $20 an hour. So what does that mean? As a native Miamian, right? Who are we? And who are we going to be for a decade? Right? I think we've all seen the reports, recent reports, about who is moving into Miami. And we've seen it in our neighborhoods. Who's moving here and who is leaving here? People moving here earn more than the median income. People leaving here earn less than the median income, typically. And the people who are moving here because they can. And the people who are leaving here because they must. I think right now more than half of the incentives and the resources that are being created in the last couple of years are going more to this 120% of the median income. That's upside down. So as we think going forward what we're going to do, let's make sure we don't miss this. So what happens if we don't have workers who can be here to make this event happen? If we don't have workers who are in our hospitals, medical assistants, cooks, if our logistics don't function, then our economy really starts to grind to a halt. So not only do we have a humanitarian crisis, which, I know that Sandra's going to talk about, what does it look like in the community today, but also our economic drivers are going to slow down.
So when we're asked, why are you in the room? How can we affect the pillars of health, mental, spiritual, emotional, physical change and improvement without housing? At the center of respite, of physical and emotional improvement, you have to have shelter. Without it, our work is for naught, and we will continue to be receiving catastrophically ill patients at our thresholds. It's about the zip codes that we're born into. It's about the communities surrounding. It's about the services that are available to the members of that community. And this is at the very core of why we're on this stage today having this discussion. If we think about how our conditions arrive, the health systems are only responsible for 20% of your health outcomes. The other 80% occur outside of the footprint of the Jackson Health System. So you're seeing us focus on partnerships and unique collaborations that we typically, wouldn't label under health relationships. Conversations very much like this. I don't know if Vicki Millette is in the audience, but working really closely with the Homeless Trust, understanding the need and where we can collaborate together to ensure alignment of goals and financial resources. Insofar as innovation and things that we can do together, I have a dream, and if Vicki's here, she can make it come true. I'd love to see in some of these affordable housing units that are coming up an iPad just embedded into the units where the Jackson Health System is just one, click away, with a telehealth capability.
We actually are unapologetic about naming housing is a human right. We don't believe it's a luxury for the wealthy. We believe it's for everyone. We believe that if we want a healthy community that everyone deserves, no matter where they come from, what they look like, how much money they have, that they deserve a place to live. The Secretary of HUD came to Miami, and she said that we led the nation in the housing crisis. And we also believe that because we lead the nation in the housing crisis, that the boldest and the biggest solutions also have to come from Miami. We have to do something about the conditions issues that people who are paying rent in Miami-Dade County are experiencing. The housing stock is poor, quite frankly. They're not well maintained. Many of the folks who live and work in Miami-Dade County are not the 100,000 folks who make $100,000. It's our folks, right? It's the restaurant workers, it's the teachers, and they should, after hard days of work, they should be able to go into a safe, healthy place to live, and we should do something about it.